this conversation. So maybe Megan, I'll invite you to introduce yourself and yeah, why are you here today?
Sure. Thanks, Marina. It's nice to be here today. For me, I was brand new to Causal Pathways with the project that I'm going to talk about today. We were doing some work with the Walton Family Foundation around innovative methods for evaluation, and that's how we came into the Causal Pathways work. We have one expert at Mathematica who does work in this area, largely in the global space. And the foundation was interested in looking for an opportunity to create like a test case and a demonstration of a causal pathways analysis in the education context in the US. And so this evaluation has been going on now for a little over a year, and we are coming to an end of it. And so it's been a big learning process for us and very interesting. And I was just saying as we got on, I've been very thankful for all of the many helpful materials that the Causal Pathways Initiative has put out and that Marina and Tom in particular have authored.
Wonderful. Well, we look forward to hearing more about that experience, Megan. Tom.
So, like you, Marina, I think I've been with the Causal Pathways group for a couple of years now. My recollection is we had a workshop among a number of people looking at how we could wrestle more clearly with causal questions and what methods would be most appropriate for that purpose. And you and I and various others have been sort of wrestling with some of those questions and some of those methods in recent years. And this is, fruit of some of those discussions. So I'm here to chip in.
Great. Thanks both. So maybe I will stop sharing at this stage because our intention today is to be as coffee break like as possible, given that we're zooming in from across the world, and to sort of be in conversation. So we wanted to sort of start with, yeah, I guess building on that opening, a little bit of the sort of journey we've been on. And then we'll talk you through some of the key aspects of the guidance. It's not a kind of step by step going through all of it, but we'll highlight some of the key aspects, and then we'll have a chance to hear from Megan about actually a use case, which is very much in the space of causal pathways evaluation with philanthropy, which of course is what this initiative has been largely focused on. So maybe I can just start reflecting a bit on my own journey, because the way we think about rigor, in my experience, is deeply connected to positionality and deeply connected to the epistemological stance we hold, whether we come from a research background or not, what form of evaluation we do, etc. So for me, the kind of the questions around how do we define rigor have been there since way back, too long to mention in years, but even before I was doing anything that I could consider formal evaluation. So kind of methodologically, I always worked in complexity aware and participatory processes of inquiry. And as an action researcher, with a lot of my sort of coming into being an action researcher happened in Latin America with a very strong kind of grounding, if you like, in Freirean thought and in Latin American views of democratizing knowledge generation through participatory action research. For me, the question of rigor was always quite an open one. And it was actually about what are appropriate ways of understanding quality and rigor, given that I'm acknowledging that multiple ways of knowing and being matter. So quite far from some of the more formal views of rigor, which are rooted in epistemological stances and often very bounded within a methodological tradition. So I guess it's that kind of openness around, but how do we define it in context, in relationship to the work we're doing with the people we're doing it, that I brought from that background into this work around evaluation and particularly around causal methodologies. So, Tom, I wonder if you wanted to say a little bit more about kind of what you were grappling with before. Is it 2, 3 years? I forget that we've sort of been working on this stuff together, but what was going on for you at that time?
So my background is somewhat similar in that I used to be a governance advisor at an INGO called Care International. And I think I was starting from a perspective of what methods are appropriate for this kind of work, which was often sort of multi-level, multi-scalar stuff, and isn't really amenable to experimental methods. And so sort of my origin stories are sort of mostly around finding appropriate methods and tools that fit those kind of areas of inquiry. And that was sort of my background probably before some of this. And in looking at some of those methods, comparing, contrasting how fit for purpose they were for different purposes, I started to identify some strengths and some weaknesses, some things I liked, some things I didn't. I think I had a lot of luck that I got to play with quite a lot of different methods. The paper doesn't speak to which are the best methods necessarily, but it mentions several different methods in there, such as realist evaluation and process tracing and tools like rubrics, for example. So I sort of played around with various of those. And one of the things I was looking at a few years ago was how do I strengthen a particular piece of outcome harvesting? And I was looking at substantiation, and I had some questions and concerns around substantiation. And I sort of played around with what could I find from other methods that I thought were better or stronger at particularly analyzing evidence. And so that sort of set me on a path to look at what kind of quality assurance frameworks are out there, looking at how, what criteria should we use to assess evidence. And as you say, a lot of that comes from a particular stance from systematic reviews and risk of bias assessments and other things. But there were also some overlaps in there that I thought were still relevant to the kind of work that you and I and others were looking at. So that was really sort of our starting point. You and I then started a training for the UK Evaluation Society, which was on assessing the quality of evidence or the strength of evidence. And in that, we had certain criteria that we'd sort of settled on as being likely important for assessing the strength of case-based evidence, so case study-based or theory-based or similar forms of evaluation. And my recollection is, I think it was probably 2 years ago, we had a conversation after one of the trainings where we were reflecting on what people found easy and difficult in the training and what had resonated and certain criteria that people had chosen. And I think we sort of asked ourselves, well, why these criteria? Why these? And it reminded me of a paper I'd read 5 or so years ago, which we'll have an illustration of, I think, in a second, which was reflecting on values more explicitly and what's called axiology. And there's a really nice diagram to illustrate this, which I think Marina is going to get up, which just simplifies, I think, very nicely why we start with what we value, or why it might be a good idea to start with what we value rather than what methods we think are most appropriate. So my starting point around methods wasn't necessarily the right point. There's lots of prior steps and considerations that are worth thinking about before saying this is the right method for this particular evaluation and this particular question. Or at least that was our thinking. And it gave us a kind of a justification for why we had chosen certain quality criteria. It allowed us to anchor some of the thinking, not in a way to be prescriptive and saying these are definitely the right criteria, these are definitely the right values, and you must accept our values, but for people to think more purposefully about what it is people value prior to making methodological decisions. And you can see on the screen more or less what we synthesized as sort of core questions around this. And then we went and developed a bit further.
Yeah, so that, I mean, my memory is similar in that we had that sort of, anchoring this in values is a helpful way to do it. And that, I think, was about the time that we started to talk about rigor and quality in relationship to the Causal Pathways initiative and the work that was going on there. So this was kind of our starting point, and Rachel's, I think, put the link to the paper in the Foundation Review, which kind of goes through this process as well. And so then we wanted to think about this specifically in the context of causal pathways evaluation and the way that was being defined by this group. So which led over probably 8 or 9 months, I think it probably was last year, going through these kind of 4 phases that you see here, starting with a group of us from across the network, and you can see some of the names there. And we started with, well, what are the challenges that we face when we are confronted with questions about lack of rigor in non-causal, non-experimental causal methodologies, which was a lot of what the debunking myths paper had started with. The whole initiative had kind of started with that. So then, based on those experiences shared, we then had some conversations about what would be, if we were to define values for this kind of work, what would they be? And based on that, what sort of criteria would be helpful to put out as a starting point for people who are working in causal pathways evaluation. And we then spent some time thinking about how this was not something you simply do at the beginning and then you're done, but actually it's something that needs to be paid attention to throughout the whole process of kind of iterative, ongoing co-design, usually in these messy causal evaluations. And then in developing the guidance, we then try to identify as many cases as possible, or case material examples. They're super many, but that would help us to really kind of show what we were describing in the guidance. So maybe we can move in now, Tom, to just sharing some of our sort of headlines, highlights of pieces of the guidance that we think are worth mentioning, partly because we're proud of them, but also maybe because they're where the challenges remain or where the conversation is still live. So maybe I can kick off just by essentially expanding this point around the fact that it's an iterative co-design, and essentially this. And we say it in the opening of the guidance. We have a section which is what is this guidance about? And we quite explicitly mention that we view this as a roadmap, not a checklist. I have a very strong aversion to things that look like checklists, perhaps too strong an aversion to them at times. But essentially that's to say that, and I know there are many conversations going on now about how to develop the right kind of guidance for systemic, participatory, complexity-aware evaluation. And there are other communities of practice that are working on guidance as well. And it's quite tricky to find the balance between guiding, so giving direction, but at the same time appreciating that the context will drive what is possible, how far you can go, etc. So it is very much a roadmap, not a checklist. And the intention with it was to create invitations with sets of questions that help you reflect and think about the decisions that need to be made along the journey, because a lot of this is around the choices that we make as we go through. Tom, maybe you wanted to say something more related to where we actually landed in our deliberations around values and principles and the kind of structure of it.
Sure. So worth mentioning as well, we had a discussion on, should it be values, should it be principles? Have we got the right starting point? Is it the right level of granularity? And how do we ground some of these big picture things, right? So what we said previously was, well, it should start with what you value. You should express what it is you care about as your starting point, because that, in theory at least, underpins what the purpose of your evaluation is, why you would choose certain questions and things like that. And so we have a few sort of top line values that I think broadly defines the community, such as it is. And so I would have said embracing complexity was one of these, where, you know, a lot of the people in the community came in because they're coming from that kind of paradigm and wrestling with issues of causal complexity or initiative complexity or looking at portfolios or what have you. Another common area that I think most of the community we're also looking at was around issues of equity and inclusion. And so that also sort of touches on issues related to, say, participation, whose voices count and whose values count. So it was really sort of the overlap between those sort of two main blocks that I think a lot of people in the community and other adjacent communities that Marina just mentioned as well are also interested in. So the inclusive Rigour group is another that has quite similar value propositions, but also because I think a lot of the people in the community are also practitioners looking to inform foundation strategy or philanthropy and to make the world a better place. There was always this underpinning, well, what about making the world a better place, and how do we improve strategy and tactics that organizations have based on, you know, relevant and usable evidence. And so that kind of led us to settle on a few key principles. So equity sort of translates also into a reflection on something rather cross-cutting around reflexivity. It's not exactly identical to equity here, but we felt that reflexivity was also something that needs to cut across how you're making these decisions. So when Marina said, this is like a process to help you think about evaluative decisions. And reflexivity is something that should happen throughout the process at different moments in time as you consider the options that you have and the merits of the choices that you're making. And what this then ultimately sort of grounds us to is sort of a general set of phases, if you like, that sort of structures some of that decision making. So you can see here, we'll go into a little bit more detail for some of these, but how you set up the process in a way that embraces these values directly. So considering how you engage people as part of the process and how inclusive and participatory you might want to be, and how you address issues of complexity as well. And this filters through to the design choices around particular questions, how you would conduct the analysis, and so how you can think about particular criteria, standards in the process that fit with these values and sort of the epistemic positions that we're talking about, and how we, I was going to say make judgments, but maybe it's provide better explanations at the end of an evaluative or learning process as well. So we're going to walk through bits and pieces of these as well, but that's more or less the sort of the overarching view of what the document is really about.
Great. Yeah. So we'll just touch on a couple more points because I want to make sure we've got time to hear Megan's kind of what did it feel like to then use it. So the first is this point that Tom's just made around, so in the setting up of the facilitation and learning process, a critical question is the who question, right? So if equity is a value we hold, if reflexivity is part of how we operationalize that, how are we reflexive about the forms and types of participation that are desired and indeed are possible? So we offered this table here, which essentially is trying to take a step beyond the very well-known kind of spectrums of participation that talk about different depths to help us think about what does it actually then mean to operationalize for a particular actor, whether it's the funder or it's a community member or it's the grantee or it's the intermediary, a certain level of participation, which relates to the extent in which they are engaged in throughout the process or perhaps only in specific moments. And we all know, of course, that thinking about how you create that space for participation of different actors requires you to think about how power mediates the ability of any particular actor to engage or not. Power could be an enabling force or a disabling force. So we offer some tools around how you might do that. And just to briefly talk you through one of the many cases, which is actually also a case study in the broader resources that we developed for the initiative. This is from an experience in Brazil. I think some of my colleagues from that initiative might be on the line. And Julia was involved with it as well, Julia Lin, that is. So this was working with 6 grantees of Imaginable Futures, all working on racial equity in education in Brazil. And as you can see, it was kind of a collaborative causal evaluation that was happening across different levels. And we had to go through quite a lot of deliberation between the funder, the local team anchoring the process, my colleague Bruna Viana, who's sort of leading on the ground, to figure out what was essentially a patchwork of different levels and forms of participation, all the way from the teachers, students, and people involved in the programs being evaluated, all the way up to the portfolio level. So just to illustrate that a fair amount of care and reflexivity goes into thinking about meaningful participation at the beginning. So Tom, I'm going to hand over for you for this last little bit, and if we can keep it shortish because we're a bit behind on time, that'd be great.
I'll do my best. So this is just to speak briefly about some of the critical reasoning and causal analysis. There's a case which is in the paper on an evaluation I was part of in Côte d'Ivoire, which is basically about community action planning and provision of infrastructure. And it's just to illustrate some of how that process went. So we were looking at a program that had been running for several years, and we wanted to involve both the project team and some of their partners, and also the evaluation team within KUK. So I was an independent evaluator, but I used to work at the organization, so I knew some of the people. And we were trying to find appropriate ways to include them in the process, both because it was a way of upscaling particular methods that we thought would be appropriate for the evaluation team, but also because we thought from previous experience that we'd had doing process tracing in a participatory way, that they could add significant value in actually analyzing evidence, gathering appropriate evidence for the purposes of the evaluation. So basically, we designed a process where we used essentially process tracing with sort of judgment rubrics around the significance of outcomes and the quality of evidence to sort of build an evaluation. And basically, this was a case where there was no theory of change to start with for the project. So we were sort of more or less starting from scratch, even though there were log frames and other things to engage with. So we started by developing a theory of change with key areas that the team could identify evidence around. We built several contribution claims around key areas of the theory of change, or the causal chains, as we call them, to then test by gathering primary evidence in the field in a few key areas. And one of the key things that I think sort of resonated, it was sort of fundamental to the process, was helping the team beyond the methods themselves, to reflect critically on what evidence meant in their context and whether it might weigh in favor or against the particular explanations they had. So they had some different explanations around what they thought different things could do. So one thing that they were trying to look at was village savings and loans associations and how that might, for example, have supported social cohesion. The problem with that was that there weren't any real clear tactics and strategy around how to do that, other than a hope that savings and loans associations would have mixed groups, and that if you had mixed groups, you would bridge different communities. So not a particularly convincing one. But on the other area that we were looking at, which is basically mobilizing funding from different actors to build public infrastructure, we had some easier stuff, I think, for us to look at. And what we found was that there was multiple actors playing roles in the process, and there were different parts of the process that different actors led and different actors followed. It wasn't the case that in this case, CARE, which is the NGO, was leading everything, or indeed that the partners were leading everything. But it was a textured story, really, of different phases in the process where they made more and less of a difference. But what we tried to do throughout the process was bring the team in on many of the core decisions, both in terms of defining which contribution claims they wanted to test, which areas of the theory of change they wanted to develop, to understand contextually what different evidence would mean if we were to find it, to then design what should we then be looking at with them. And then myself and the KUK evaluation team basically wrote up the findings that the team had gathered data on. And we can probably talk about levels of participation around that and whether they should have been involved in the final stage. But it was one illustration of how we supported a team to be actively engaged, mitigating biases at the same time, and having a reasonably sound process, I think.
Great. Thanks for that, Tom. Now, there's lots more in the guidance we could go on about, but I think it would be nice to turn to Megan now and invite her to share her recent experience of thinking through this in a real live causal pathways evaluation case.
Thank you. Okay, so I will walk you through, try to be quick here, what this looked like for us. I want to ground you in what is the actual example, which was focused on virtual and hybrid school models. So it was an evaluation of virtual and hybrid school models in the US. And overall, it was a causal pathways evaluation of 4 total models, 2 virtual and 2 hybrid, and using a theory-based approach. And we had kind of 2 goals. One was the evaluation goal, which was basically, let's generate evidence about kind of different recipes for virtual and hybrid learning and really understand when do they work, for whom, and under what conditions. And we wanted to do that. Our causal pathways study was going to focus on the, how, why, under what conditions portion, and it was meant to complement an outcome study that was being led already by the Intermediary Organization, which is a national nonprofit that's worked with these virtual and hybrid school models and funded them in the past. The second goal was to model a practical application of causal pathways approach in the US philanthropic context, as I mentioned before. So the models were spread across the US, were mostly high school age. One of them was elementary, and we used a variety of different approaches. So we had theory building workshops with school leaders. We used those to develop theories of change with them and specify the hypothesized causal pathways. The study involves 2 rounds of data collection and analysis and co-interpretation with school leaders and other interest holders, and a variety of data sources, largely interviews and focus groups with different types of interest holders, and then literature reviews, student and teacher surveys that were being collected by the Intermediary Organization, and then the results of the intermediaries outcome study. I won't spend much time here except to just say that our plan was assumed we would evolve over time, that part of the goal was to have these multiple rounds of data collection, analysis, sense making, through which we are refining, changing, updating the causal pathways. And so it was meant to be iterative and cyclical. And so let me just pause here and say, like, when did the guidance come in and when did we start applying it? So the guidance came out in early January. At that point, we were sort of in the middle of our project. If you look here, we had completed one round of data collection analysis, and we were just getting ready to start our second round of data collection. We were in conversations about what is quality assurance going to look like in this study. My role on the project is I'm a senior advisor and a quality assurance reviewer. And so part of what I do is to help the team understand, like, what does quality look like and what processes should we put in place in order to ensure quality. And we wanted to think about, as Tom and Marina were just talking about, like, what does that mean in terms of the causal pathways analysis? So I would say at the time, like, we had finished one round of data collection. What was in place already was a lot of our kind of normal approaches to quality control and quality assurance by method. So there's a lot of different methods that we're using. But what we didn't have at this time was really anything kind of holistic or thinking about how do we need to think about this given that it is a causal pathways evaluation. So it was really great timing when this came out, in the sense that we were like trying to figure this out. And then this paper came out and we were like, great, let's use this as our, guiding document to figure out how to do this. On the other hand, it was also like not the best timing, in the sense that we were kind of halfway through. And so we lost some of the opportunities that Marina and Tom were talking about to use the guidance to inform earlier stages of the study, like the design and the actual data collection. So if you look at this little figure, our focus, because of where we were at, like, our entry point was the third thing here. We were thinking, how are we going to assess the overall strength of evidence of this causal pathways study once we have all our data together and we've done our analyses? And so we ended up coming up with a 3-step process to get there. We decided we wanted to develop a strength of evidence rubric, like what Tom was just talking about. And we sort of used the guidance that Marina and Tom have been describing to come up with, like, what are the steps to get there. And I'll just quickly show you what those steps are, because I think it's helpful to understand how did we actually do this. That was one of our takeaways from the guidance, was this is really helpful, but now let's think about what does it look like to operationalize it. So we started by surfacing our priority values. This was interesting to do because it was in the middle of the study, as I said. The we in this process was the set of 3 researchers, all at Mathematica, who really had been the core study team doing the data collection, the design, the analysis. And I helped to facilitate the process with them. And then we shared the results of this with some of the other interest holders, the funders, and then the intermediary organization that I mentioned. So our approach to this was kind of open-ended, but we had it anchored in people's prior experiences of high quality evidence. So it was basically a facilitated conversation and activity. And the result of it was to come up with a list of what our team's core values are that are relevant for quality in this particular evaluation. And this little table on the right is what came out of that activity that we did. So we came up with 4 core values: collaboration with program users, critical reflection across multiple sources and lines of evidence, elevating lived experience, including multiple voices, and usefulness. And then on the right, these are like the specific words that came out related to each of those in our activity that we did. Next, we did an activity where our goal was to say, okay, so based on what our values are, what are the most important criteria for quality of evidence that we need to make sure we're attending to in assessing the strength of evidence of our overall study, and also that should influence what we're doing in our last round of analysis. And so we did a diagram exercise, and our starting point was focusing on 8 quality criteria that Tom and Marina had distilled from various guidance and kindly shared with me. I developed definitions and sort of descriptions for each of these. The team was invited to identify any gaps in case there were things we should be considering that weren't in that list. And then we did this activity to sort of surface, okay, what things do we think are most relevant and most important and aligned to those values that we had come up with? And we ended up with 4 key ones that our team focused on: triangulation, plausibility, transferability. And we actually combined responsiveness and representativeness because of some specifics of how things looked in our study. And then our third step was then developing a strength of evidence rubric that covers each of those 4 things. And for this step, we started with a lot of the examples that were linked in the guidance. The causal pathways rubrics I found particularly helpful for a lot of these. A couple of them we did need to adapt for our case and think about, what makes sense in our case. And then our plan from here is that we both are using this to guide some of the analysis and quality assurance processes that we're doing in our last round of analysis. And then we will use it to have quality assurance reviewers assess the overall strength of evidence of the final findings for the study once those are ready. Okay, let me stop sharing so we can talk.
Great. Thanks so much, Megan. Actually, I do have a couple of questions, but there is also one from Vivian in the chat, who asked whether the community members were involved in any part of the design analysis or sense making. So maybe you want to, reflect on that first.
So we had sort of different layers of involvement in our study. The community members, as in the folks who implement the program and receive the program, so students, parents, and teachers and other staff of the schools, they were involved in data collection. So they were our main sources in our interviews and focus groups. But one way that we tried to build in some more participatory sense making with them was through the staging of the interviews. So in our first round of interviews and focus groups we did, the protocol were much more open-ended, I would say like kind of more traditional types of interviews where you're asking people about what your experiences have been, tell us stories about it. We're trying to kind of build what the theories are. The second round of interviews that we did, we designed to have a mix of that and asking folks to actually react to the hypothesized causal pathways that had come out from the first round and sense making with the developers of the school models. And so we asked them to engage in sense making in the actual interviews and focus groups, which, as you can imagine, looks very different depending on who you're talking to, like students versus teachers and staff versus parents. In terms of more traditional participation, we have members of the intermediary organization and developers, sort of staff of each school model, who many of them are true developers in that they sort of created and run the models, and some of them did not originally develop it, but are now key staff in like running and improving it. They have participated in sense-making meetings, and they are the ones with whom we did the workshops in the beginning to actually develop the original theories, and then we have multiple sense-making meetings with them along the way. The one group that hasn't been very involved is our funder, the philanthropic organization. They would, I think in that chart that Marina showed, I would put them like in the bottom, like they want to be aware of what's going on, but not really an active participant. And so our approach with them has been to kind of update them along the way. But I would say they have not really participated in sense making.
And that's a really nice example, I guess, again, of that idea of the patchwork, no? And thinking quite carefully about the purpose of how you involve in those different moments, etc. Yeah, that's interesting. I guess the question I'm holding is, so you said, Megan, that your role is quality assurance. You guys started off with your normal quality assurance processes, and then you said this was different because we were doing causal pathways. So how did doing this process look different, and did anything surprise you about doing it? Like, how did it feel to do it differently to maybe your sort of normal quality assurance processes, if that makes sense?
Yeah. I mean, in terms of, well, I'll start with your first question. What, how did it feel different and sort of what was the outcome of that? So I will say that, a lot of those criteria we ended up with, there weren't any of them where it's like, oh, whoops, we haven't attended to this at all in our design. But what I think was very interesting about this is that engaging in a causal pathways analysis has made me very attuned to how in a causal pathways analysis, it's all about complexity. And so it makes sense that there are so many levels that you need to think about. So when I first was doing this work, I was like, oh, it's like case study work. Like there's individual cases and those cases are rolled up into groups. And it's like you have cases of cases and so on and so forth. And you have to understand all of these. And I think that's very true that our team was experiencing. Like we had approaches that work pretty well to assure quality at certain levels. Like, do we think we understand, plausibly what this individual respondent was saying in this interview? But what we didn't have in place were intentional processes to ensure that we were hitting those quality marks at every level, because you can think about like rolling up by data source, then rolling up information across data sources, and then rolling up information to the model level, and then trying to draw conclusions, within a causal pathway and then across causal pathways within the model. So there's like all these different levels you can think about. And I think that when I came to our team to help them think through what should we do at this stage to ensure quality, one of the things they were experiencing was like a high level of anxiety because of all of this complexity. The idea that like, is what we're doing enough? Like, what if, we're missing something? And so I think it was very helpful to have this kind of structure to be able to work within, to ensure that we are being reflective about all these different levels. And it did lead us to make some, to introduce like new processes that help us think more carefully about certain things, which I can talk about if people are interested. Um, to address your question about what was surprising, I would say like one thought I had was when we started this, it's mid project, and I thought, who knows what's going to come out of this? We could get in this values meeting and discover that the team has like all different values and it's kind of a mess. And then I was thinking, and then what will we do? But we'll figure it out. It was actually surprising to me that even though we had not had this conversation explicitly, that the team was pretty well aligned on their values. So I guess that was a happy accident, but I do think part of that has to do with some other ways that we had been aiming to be reflective throughout the process. The other interesting reflection to me was in coming up with the criteria we wanted to focus on in the rubric, and the idea of like not trying to put everything in the rubric, but the things that are most important to have somebody assess at a holistic level. So, if you like looked, if you were able to see those 8 things that I had in that spider diagram and you're a researcher, you're probably thinking like, I mean, all of those are important. You shouldn't ignore them. There were some like ethics. It's like, we're not going to not do research ethics in our study. But something that I found interesting was there is like a differential level of existing structure and institutionalization of practices to ensure quality along different criteria. So for ethics, there's a lot. And those are things that like we do in all of our work, and you need to think about it, but it's like we're very practiced in doing it. But then there are others like plausibility that I would say comes out to some extent in how you do any probably qualitative work. But there aren't a lot of like well-established processes for what exactly does it look like to ensure that quality. So it was helpful to us, like I would say how we were using this was really like identifying gaps in our existing procedures to help give us greater confidence that we're doing our due diligence and producing the most, useful, plausible, accurately representative of what people said, evidence at the end of the day.
Thanks so much for that, Megan. Yeah, I mean, you're highlighting there the intentionality, right? And making the point that even if you have things in place, even if you've done this before, like actually stopping and being intentional, yeah, can be helpful. I think I'm gonna ask us to open it up, if that's okay, Megan, to see if others have any questions for you or me or Tom, or any reflections on what you heard, but also any other experiences. There's plenty of very experienced people in the room. So you guys might have other things you want to share about how you grapple with this question, whether you use similar criteria, whether you have a different process. Yeah, feel free to raise your hand and come in, unmute and speak. And Rachel, or Tom, if there's anything in the chat that I'm not capturing that you think would be good to bring into the room, also please do. Anyone want to jump into the conversation?
I can chip in on one very briefly, just to respond to Megan's point. I was happy to hear that you made a choice about criteria. We've had very similar conversations around how many criteria can you actively assess, and at what point does it become overwhelming and possibly counterproductive. And I had a very, very similar experience in terms of saying, okay, but you have to prioritize which ones do we want to look at more carefully and which ones are sort of background. And ethics is one of those that some organizations are very good at and some other organizations are very bad at. If you're very bad at it, maybe it's something that you should be a bit more intentional about. But I think it's a healthy approach to say, where are we not that strong or not that explicit, and how can we bolster that? Sounds like a very sort of sound way of approaching this, because you can't do everything, you can't go to every level, you can't tick every single box in nearly all cases. I know there are some people out there that think that we can evaluate everything, but I'm not one of them.
I will add one thought in response to the chat that's happening around this idea of like linkages versus pathways and kind of full mechanisms. In all honesty, I would say that's something we are grappling with very actively in our evaluation, particularly because I think of the types of data that we collected and just like how deep it isn't. We very rarely have data that is directly drawing linkages like across a full pathway or even, with three things, I would say. Like it's much more common that at best we're hearing directly about linkages between two things in a pathway, like an intervention and a mechanism or a mechanism and an outcome, but not, really linking everything together. So there's a lot of interpretation that happens there. And when we were developing the rubric, one of our big conversations was like, what's the right level of analysis to ask our raters to do for the rubric? Because we have a lot of linkages and a lot of pathways. And so it could get crazy very quickly if you ask them to rate every single linkage within a pathway. And I think to, part of the point in here, it doesn't necessarily at the end of the day help you say, what do we think is the strength of evidence for the overall pathway, which is actually the theory that we're presenting. So we've made the choice to assess it at the pathway level, but to allow the raters to indicate when they think a rating for a specific criteria differs for different parts of the pathway. But I did see in some of the example rubrics, they chose to do it like by hotspot and essentially rate by linkage. And I could imagine this like varying based on how you're doing it. And I won't get into it, but in terms of the actual analysis, we are trying to do the analysis at the pathway level and not just at the linkage level for similar reasons.
Thanks very much for that, Megan. Yeah, great comments in the chat. Yuta, I see you have your hand up, and then maybe Megan and Tom, we can reflect very briefly on any questions coming up in the chat. But Yuta.
Yeah, thanks, Marina. Fascinating. And I'm stuck on the same issue every time. Participatory evaluations take a lot of time, and particularly take a lot of time away from the participants on the ground, community members, and from the group who's actually implementing, from the operational one. Now, again, Megan said they already, I think in total it's taken over a year now. Whenever I invite people, one invites people, participants and operational staff into spending more time, in this case, doing all the work that I completely convinced by reviewing to increase rigor, they go, please, no more. We don't even have time enough to be part of the evaluation team because we have to earn a living, because we have a family to look after. So how have you dealt with this? How have you felt about it and the people you worked with, and how have you responded? Thanks.
Thanks very much, Yuta. So we've got about 2 minutes left. So I'm clearly we're not going to answer all the questions. Tom, do you have a 1 minute thought on that? And then Megan, and then maybe I can do 30 seconds.
You go ahead. I was going to try and see if I could do the experimental one, because I would answer that one.
Okay. I mean, my quick response, Yuta, is precisely that you don't. It's not about everybody needs to be involved in every step, right? And actually, when it becomes a burden, that it isn't the right thing to do, right? If you're seeking equity, burdening isn't the right thing to do. I think sense making is fundamental. I would say in the values conversation, and to some of the comments in the chat, you can open up a values conversation with simple language. Yeah. I think you can talk about criteria by translating the technical terms into simple language as well. And I've seen that done very well. Even, for example, the Movement for Community-Led Development did something in building a realist evaluation based on community values and understanding. So it can be done. And then the second piece is the sense making, right? Because it's in the sense making that the different perspectives of that complex causal dynamic is really building in rigor and really building in robustness to your understanding. Megan, over to you, and then Tom for your 30 seconds.
I agree with the sense-making piece. I think raising this burden concern is a really important question, one that I find is not sufficiently attended to in our thinking. I generally approach this with trying to be very flexible and I would say pragmatic. Like, I think about the underlying goal of participation is to both bring the perspectives, but also ensure that we have value for the people that we're trying to have value for. And so a lot of it for me is very context specific and thinking about what's appropriate based on what we know, and then prioritizing, as Marina said. So thinking about, like, I often find the key places are sense making, as she said, and the very beginning, like ensuring that what we're even studying, people actually care about. Because if you're doing a study and they're like, great, good for you, they don't want to spend their time on it, that's a problem from the beginning. And so I do think our sense making along the way in this case was a way for us to be able to provide them information while also getting the sense making. So even though the study is long, they're not waiting till the end. Like, they actually found it, the model developers found it helpful to work on the theories of change in the beginning. That helped their thinking to do the sense making in the middle, and then to do sense making again toward the end before they get to see the final results.
Megan, sorry to cut you off, but we are over time. If people need to leave, thank you so much for coming. Apologies that we ran over. If you've got a minute or two, Tom, go for it.
So my 2 cents on this would be, I think the two areas I've found most valuable those inputs have been is in claim making, so particular contribution claims, and in evidence identification. I think that's where I've found the most useful inputs from teams, partners, communities, and others because they can see things I can't. Um, so that's been the most helpful for me. I just wanted to quickly have 30 seconds on the experimental piece. The point of starting with values is to be explicit, whoever you are, about whatever you value. Some people would say they don't have any values and they're just objective, but objectivity is itself a value, right? And so whether it's reliability or any other criteria you may have, I think the important point is to be explicit about what those criteria are and use that as your guide to what you're going to be more explicit about caring about. At the start of the evidence review process, I looked at something like 40 or so quality assurance guides, and there are plenty of criteria in there from those kinds of methods as well. It's just a question of choosing which of those criteria are most appropriate to what you most care about. That'd be my answer there. Hope that helps.
Rachel, over to you. Thank you so much, everyone.
Yes, thank you everyone for joining. And this was just such a fascinating conversation. So huge thank you to Tom, Marina, and Megan for sharing your work with us today. And we hope to see you again at a future coffee break. Thanks, everyone.